stay on my mind. Think about you all the time. Got to get to know you well. If you kiss, then I will tell. You stay on my mind.
Morena, you're back with breakfast. It's 8:25. Angela Lim started out as a hospital doctor in Starship, but what she saw prompted her to do something. Our mental health crisis and youth suicide rates. Something had to change, and so Clearhead was born, a free online mental health platform with an AI therapist to help self-manage mental well-being, but also provide referrals to 230 therapists around Aotearoa. She's now been recognised for that work, being announced as a finalist for the 2021 Women of Influence Awards. Angela is with us this morning. Morena, Angela, congratulations.
Morena, thank you for having me.
Well, it's nice to have you back. Actually, how does it feel to know that the work that you have done and continue to do has been recognised on this platform?
Yeah, I mean, I think for me, the recognition is less about me and it's more just about, it just gives more credibility and more visibility of the change that we're trying to make, and that it is possible. And so we've achieved it for 6% of the New Zealand working population. Let's see it for 100% of New Zealand.
Yeah, that's amazing. And I want to talk about the change that you are seeing. But first of all, tell us about working as a doctor in Starship, your experiences there that led to you starting Clearhead.
Yeah, so for me, I think the challenge that I often felt was that often patients came sort of more at a crisis point. And there were so many opportunities when you listen to the story that they tell you where they could have been seen much earlier out in the community, or they could have been supported with a bit more information on how to self-manage. And our health system just is completely not equipped to do that. Less than 5% of those who need professional help actually get seen. And that's because the demand that needs that professional help versus the workforce that we have, the modeling just don't match up. That's why. So, the same way that if you have 100 people rock up to the emergency department, and if 95 of them get turned away, there'll be a huge hoo-ha. But because mental health is such an invisible problem, we let it slide. And yeah, I just have always been someone who couldn't just look at a problem and not do something about it, especially if I didn't see change coming. And I wasn't seeing any sort of dramatic changes that would change 5% of the people getting help to 95% of people getting help.
So tell us about Clearhead then, and then how it works.
Yeah. So basically, you start that journey of chatting with this, digital wellbeing assistant that we've created. And the system's actually really smart enough to triage you in 3 ways. So if you kind of come onto the system and you say, I want to kill myself, it's able to trigger that you are in crisis and then put you immediately to the free 24/7 helpline to be spoken to by an individual. But if you kind of are just your situation is complex, but you're not acutely unwell, it then actually refers you to our network of therapists. And actually, we have 280 now in the country that can see you either in person or online. And then for the large majority of people who don't want to seek therapy, they just want to solve their own problems, we educate them on how to do that through very bite-sized videos. They're less than 2 minutes long. It teaches you about, here's how you identify anxiety symptoms. Here's how you learn about how to take deep, calm breaths to stop your panic attack. And so that means that, we've gone from just only 5% who could get through the system to now 100% of people who reach out will get help. And then maybe just to give you another dramatic contrast to what we've been able to deliver versus what the public system is able to deliver. So currently in the public system, you have to see the GP. For most people, you have to pay this out of pocket. And then the GP has 15 minutes to quickly figure out that you have an issue and then make you jump through a few hoops to say, are you bad enough to qualify for publicly funded therapy? And then if you do, the average wait time is 4 months. You don't get to choose who you see. You just get it, and that's kind of the typical process. On Clearhead, if the only criteria is you want help, you don't have to be acutely unwell. And so one of our users reached out at 11 p.m. on a Saturday for an appointment at 2 p.m. on a Sunday. And that whole process, from when that person reached out for help to when they got seen to when we got invoiced for the therapy delivered, took 14 hours. There wasn't someone trying to coordinate that care. It happened in person. It happened after hours. And that was not an acute case. That was just a typical case. So our wait times is less than a week compared to 4 months. So that's what we're saying. It's possible. And if we can deliver this through our corporate and insurance partners, why can't we deliver this for everyone else in the country? Because they deserve that help, Yeah.
The awards aside, I just want to thank you for the work that you are doing. And I remember having this conversation with you when you were here on the show. I think it was back in July, and that really stuck with me, the work that you were doing. So thank you. Congratulations on having that recognised. If someone actually wants to tap into Clearhead, how do they do that?
Yeah, so we have a freemium offering, but that means that they'll still have to pay for their own therapy. And so we work with basically health insurance companies like NIB, like Unimed, where actually that's fully covered by the insurance company. We also work with large corporates like Foodstuffs, which covers, Pack and Save, New World, and their employees also get therapy and the sort of digital tools covered. So I guess the easiest way is there's a free sample. But if you really want proper support, please get your employers to bring us in, and we're very cost effective.
Brilliant. Well, congratulations, Angela, and thank you again for the work that you are doing. Angela Lim, Clearhead CEO. Thank you.
Thank you, Jenny.
Well, it's just gone 8:30. The Prime Minister is frustrated with anti-lockdown protests in Auckland over the weekend, saying if everyone who attended got vaccinated, we'd be closer to